Welcome to Resilience Redefined. I'm your host, Michael Osterlink. This show is about building better humans, institutions, and systems. On the show, I'll be interviewing many different experts from across many different fields, including human optimization, health and fitness, team building, mind-body medicine. In the institutional space, we're looking at different institutions and how we can create new ones, new models and maps, including in medicine, in education, in intelligence community, in law enforcement, in the military, especially in the special operations community. Thanks for being here and enjoy the show.
Dr. Vincent Recine is a movement specialist and founder of the personalized physical therapy practice Prime Physio in Westchester County, New York. Raised in the Bronx, his path into physical therapy began as a high school athlete facing recurring injuries, a journey that sparked his passion for understanding the human movement and performance. Vincent holds a doctorate in physical therapy from Hunter College and a BS in athletic training from Sacred Heart University, and is certified in functional manual therapy, athletic training, strength conditioning, and corrective exercise. At Prime Physio, he focuses on chronic pain, sports-related injuries, TMJ dysfunction, and performance optimization, emphasizing one-to-one care that treats the person, not just the condition. Good to see you, Vincent.
Likewise. How you doing?
Good, good. And I know that all to be true because you're a practitioner that I've been seeing. You are very holistic in your orientation or comprehensive, whatever word we want to use, which I really, really appreciate.
Yeah. Thanks for the intro. Thanks for having me on.
Yeah.
I totally agree with everything you just said. I pride myself in trying to treat the person, not the condition. I think in Western medicine, we've gotten to diagnosis heavy. And, when you do that, you look past all the important factors, that a person goes through in their life, which may impact why they're here in the first place.
Right on. And I do kind of want you to kind of unpack your more holistic, comprehensive, whole human system approach. Before we do, what led you down this path to eventually do what you now do professionally? And I mentioned, you're an athlete in high school with some injuries. Talk to us about like that and then your academic studies.
Yeah, so I had a few injuries back in high school, had a few surgeries, and I remember distinctly saying to my mom when she had taken me to PT, I was like, "I'll never do this. I don't want to do this for work." It was a mill clinic, they kind of had 2 or 3 people in there every hour. There wasn't much personalized attention, a lot of cookie cutter approaches. So it didn't, pique my interest. And then I was part of this group in high school. It was like a volunteer group, and they used to have people come by and lecture and so on and so forth. And there was a woman who came by and talked about PT like it was the end all be all. She just was very vibrant, lovely woman, smart, all the characteristics you'd want someone to have, while they're helping you rehab an injury. So I asked to shadow her, and it was a totally different approach. It was one-on-one. She'd see one patient in an hour. She really used her hands, like, not only for diagnostics, but for treatment. And I was like, wow, this is something I can definitely do. I grew up in an environment that was, more didactic, I guess you would say, less sitting down learning and more, using my hands. My father's from Italy, and he became a plumber, and you know, he was a handyman kind of guy, and wasn't quite as interested in doing that. And then I said, all right, this is kind of a good blend, right? I can't sit in front of a desk. I'd go nuts. So then I thought this was a good route. And then, so I went through it thinking I would work in professional athletics. I eventually got to professional athletics, and then I did not like that at all. And then I took my first job where I started learning about, the TMJ and headaches and migraines and stuff like that. That really piqued my interest. And then that's kind of where I've taken my career in the last 5, 6 years, is really honing in on patients who have jaw pain, migraines, headaches, face pain, things like that. And it's evolved to other things, as you know, kind of, even some Eastern medicine approaches, some energy techniques to treat patients who are a little bit more complex, who won't respond to the typical, soft tissue work that we would use on someone who comes in with like knee pain. You know what I mean?
We'll definitely get into some of those. I want to call them esoteric practices because they're just as useful as any conventional Western one too. I also want to add too that you also do visceral manipulation, organ, and I want to talk about that as well. But talk about the TMJ, like that's kind of a unique subset. What led you to even think about exploring that as a topic to eventually teach and work with clients on?
In my first job as a PT, we had a relationship. The clinic I worked at had a relationship with this dentist, Dr. Michael Gelb. If you've ever read the book Breath by James Nestor, he's mentioned in there. And we used to shadow him, and he exclusively deals with patients who have jaw pain. And he's been around the block. He had a lot of knowledge to share. He has a specific approach that he uses, and I started to learn how physical therapy was a great adjunct to that, and then how you could help integrate the rest of the body to help heal someone who has jaw pain. And, I always tease dentists when I work with them. It's like they look at the teeth, right? That's what they're taught to do. And the therapists look outside the body. And if you combine the two, you could really have, pretty amazing results. But these patients were so debilitated and no one really knew how to help them. And I saw such a need. And I said, this is what I'm going to kind of devote my practice to, because I was just interested in it too, right? It's challenging. There's so much going on. I had to learn a ton about dentistry. I had
Mhm.
to learn a lot about like sleep medicine, and then all the other muscles and anatomy in the face, right? Like you have the eyes, you have the nose, you have the ears, you have the cranium, which is so many bones, and then all the brain components and the nervous system components and how it all affects, up top. So for me, it was fun to step away from, an ACL rehab or hip replacement, which is pretty simple, to someone who's got like pain behind their eye. They're missing a few teeth. They're ringing in their ears. They can't turn their head to the left. And on top of that, they have an autoimmune disorder. Like, that's a fun patient to treat. And it's also, selfishly rewarding when you could help that person, you feel good about it. And that person's super grateful because they've been kind of given the ring around. Because as we mentioned, Western medicine has turned into such a silo, right? Like you see the endo for your hormones, you see the neurologist for the nerves, you see, this doc for that. And then no one's really putting it all together. And ultimately the patient suffers. So I said, all right, this is a cool place I could take my career. And so far I'm loving it. I would say 80% of what I treat is TMJ pain. And the rest is a mix between orthopedics and some other like issues, but like it's fun. I don't get bored of it.
Yeah, and one of the things more intellectually that you and I connected over, because as I shared with you, my father's, in the 80s, I think it was the Society for Occlusional Studies before TMJ was even recognized by medicine and dentistry, like, it's kind of really cutting edge. And I remember him telling me back in the day that most doctors, even dentists, would poo-poo it. Oh, that's not a real thing. Those headaches, and a lot of women apparently were not victims of it, but like suffered from TMJ at the time, and it was all in their head. It wasn't a real condition,
Right.
and that was a big thing that at the time dentists who were actually involved in this kind of stuff had to get over. Today, is that less so? I mean, is it like most doctors and dentists recognize TMJ as a real phenomenon? The symptoms as a result of it, the headaches and the things like that, are things they can recognize and maybe not work with, but point to someone like you to work with?
Yeah, it's definitely more recognized, but what I do see is someone who's been in pain for a while, and there are practitioners who don't know how to deal with them. They definitely do kind of get marked off of like it's in your head, this isn't a real thing, and and in my opinion, that's not the case. It's just the TMJ or the jaw pain or the headaches is the first layer of what's going on. Once you start kind of peel the onion back, you start to find out like, okay, I see why this is happening. Again, not to make this all about poo-pooing on Western medicine, because obviously there's a ton of good things about it, but like most practitioners don't have an hour with their patient. So if
Mhm.
they can't fix the problem in 20 minutes, it almost becomes the patient's problem. And it's like, no, you're just not really diving deep enough to understand um, what is the undertow in the case. Uh, but it's definitely more recognized than I would imagine in the 80s. I mean, there's a lot of people who are looking at it as a systemic problem in the body. If you're constantly clenching your teeth or have pain there, I think the next step in medicine is how do we really attack this? Because everyone's got a different opinion on where to start.
Let me ask you from like an evolutionary biological perspective, is it more of a problem now from the types of food we eat or the lack of breastfeeding as example? Are there causes culturally, that you can point to? Or is it do you imagine, there's always been a subset of human beings that have had this condition?
definitely, if you have ever heard of the Dennis Weston Price, he talks a
Yes.
lot about this. So it's definitely a byproduct of, our societal and behavioral changes, right? Softer foods, less nutrient dense foods, less breastfeeding. Um, so what happens is if you're not chewing arduous foods like meats, tough veggies, the tongue doesn't develop the palate, and meaning the top of the mouth, and the top of the mouth is the floor of the nose.
Mm.
That makes sense? So
Yep.
what happens is you get an underdeveloped maxilla or palate, which also leads to breathing issues, which then has a direct correlation to people having like recessed jaws and breathing problems. And then you see, the secondary effects, the clenching, the grinding come as a resultant of that. However, when I first started doing this, I asked everyone if they were breastfed. I still do ask the question. I'm just not so hell bent on it anymore because I know plenty of people who are bottle fed who don't have a tongue tie, who don't have any jaw issues, who don't have any sleeping issues. You know what I mean? So sometimes people just clench because they're nervous. Some people clench because they don't know how to manage their stress, and that's their body's avenue of doing so. Um, so I guess I've kind of dialed it back a little bit because I know a lot of people who grew up eating soft foods like the squeeze things that are like made of fruit, and like the soft mush for what was like the Gerber food. You know what I mean? Like my generation grew up on that. Yes, there's a handful of us that have problems, but like I ate that stuff. I wasn't breastfed. I don't have any of those issues other than my teeth not being straight. But uh, I also think that's from me getting knocked in the face a few times. Uh, but in any case, there's definitely big correlations between it. There was actually a big piece in this on this, I think back in 2021. It was around COVID in the New York Times. They did a really nice piece on it. If I can find it, I'll send it to you. But
Yeah, please
it was
do.
very nice lay person to eat, like easy read and just interesting facts.
Nice. You mentioned the nose and breathing and stuff like that. So I want to bring in sleep apnea because I also know that's an area that you work on as well. What are you seeing with sleep apnea, and how do you think about treating sleep apnea?
So there's different types of sleep apnea, but the moral is the baseline of it is people don't have a big enough airway. Now, why don't they have a big enough airway? Some people anatomically, their airway is just tinier. Some people, their airway is collapsing because they don't have enough strength in the back of their what would call the soft palate, right? Or the area right before you start to hit the trachea is not strong enough or functional enough to keep the airway patent or open. Some people have recessed jaws, so when the jaw slides back, it creates like a mechanical compression, if you will, and that makes the airway smaller. Some people can't breathe through their nose, so they're forced to breathe through their mouth, which disrupts their breathing. Why can't they breathe through their nose? Could be they may have had a fracture there or some sort of trauma. They may have a birth defect. So that basically makes people wake up in the middle of the night, which creates apneic episodes. I wouldn't claim that I can fix sleep apnea. However, there are things we can work on to help develop strength in the tongue, the soft palate, the neck, clear soft tissue that might be pulling on it, and help create a more supportive system within the mouth
Nice.
and even in the nose, which would then help them breathe better and not have a collapsed airway. But I mean, if you read any sleep apnea journal or article, the first step is making sure the patient isn't overweight, which I don't have to explain this to you. Being in the space, 50% of our country is overweight, which is a big problem. I actually had a patient who was referred for a CPAP, and she was about 50 pounds overweight. And I had told her bluntly, I said, listen, you can go get the CPAP, but I can also help you, change your diet and work on your exercise plan and lose 40 pounds. Then by all means, if you're not getting the results that I'm saying you can get, maybe go to a sleep apnea device, maybe get an oral appliance to help you breathe better. And then she ended up not needing it because she
Oh,
actually went
okay.
through, she lost 40 pounds. She's like, Vin, my sleep's better. She had a repeat sleep test. It was fine,
Nice.
you know? I'm not doing anything fancy, it's just having an honest conversation with someone and being a, like, a lot of times people don't want to offend someone. It's like, it's not offensive. It's medical advice. You're overweight. You're having secondary effects from it. Let's try
Yep.
and get you to lose the weight. And then I've also seen cases where the sleep apnea device is a means to an end. Let's get them sleeping so their
Mhm,
body can operate a little bit better
mhm,
while they work on the diet and exercise and then wean them off. That's a fine approach too. It's just a slippery slope because everyone wants to get fixed yesterday. So if you give them the solution, the quote unquote solution, they may stick on it the rest of their life. So that's, knowing your patient and knowing, hey, which direction are we going to go here? And I don't want you to rely on something that you may not need.
How much of your patient time is spent thinking helping them people think through and create, like, training program?
I had a patient yesterday. It was a second visit. I haven't even put my hands on them yet because we're just going through what they're doing day to day, how to
Okay,
manage, what's going on, mechanically, how they're sitting at their desk, what are they doing when they get home from work, how are they handling their sleep, what are they eating, their diet's poor, why? Because they're not prepping. Okay, how can you prep? And it's really just it. In some patients, almost evolved into a consulting role where
yeah,
it's like, hey, try these things. You know what I mean? Um, but I would say not that much overall, but I do have those patients where I'm just kind of really programmed for them. A lot of it's after we've gotten them through whatever injury they have.
okay,
Yeah, here's the plan. And then I also work with a few trainers that I say you need a little bit more long-term prep, and they're also um they need an appointment time with somebody. You know what I mean? And once I get them out of pain, it's like, don't come to me for that. Go see someone who kind of does that every day.
got it. Okay, cool. You mentioned, like, computer time. I'm kinda curious, as more and more people spend more and more time on the computers or their iPhones or whatever devices they have, they're kinda doing this all day long. Are you noticing trends, especially in younger people, in terms of posture and then the negative consequences of particular posture being kind of ingrained in the nervous system?
Yeah. So I'm a big believer in nothing is quote unquote bad for you, right? Like looking at your phone isn't bad. But when you multiply that over 10 hours a day, over 7 days a week, then it can become a problem. So, for example, I have teenagers come here and I check their phone. They have screen times of up to 12 to 15 hours.
Wow.
So that means they're on their phone for the majority of the day. Now, again, I look at my phone, my screen time's probably 4 hours a day. Not saying it's good, not saying it's bad. But my point is, I have a much better chance of counteracting the negative effects of that versus the 15-hour person. So I believe when I see someone like that and they're coming in with symptoms, it's 100% related. The battle I fight is getting them to stop, you know?
What are some of the symptoms you would see, whether a young person or an older person who's chronically doing that position, whether it's a phone or a computer?
Headaches.
A
Almost
headache?
always leads to tension headaches.
Okay.
Some people are mutants, like, it doesn't affect them. What I mean? Like, that's just who they are. Um, but it's either that or neck pain. And you know, you don't need to go to see someone if you have neck pain. What I mean by that is plenty of people are sitting around and they have pain. They're just ignoring it. You know what I mean? And some people will go the rest of their life and they'll be perfectly fine. Some people, it'll manifest into a big problem.
Mhm.
However, I tend to educate people. And it's like, if you live your life, again, I'll give you a patient case to really illustrate this. I had a patient who came in once who said she had a headache every day at a level 5 out of 10 from the
Mm.
minute she woke up to the minute she went to bed. And I'm like, "Have you ever," and she's never had PT, nothing. I'm like, "I don't care if you see me, but, like, have you ever considered addressing this?" She's like, "Well, I just thought that was normal." And I'm
Wow.
that's crazy. So long story short, we end up getting rid of the headache. She did great. And she's like, I can't, she had said to me, I can't believe what I was missing out on. Like people don't even know how it was affecting their life. So what I try and educate people on is like, it's not necessarily about not being in pain, but like think about performance, right? Think about an athlete. They're not always thinking about getting out of pain. They're looking at how to get better. Think about how more you can suck out of life if you don't have to think about a headache all day long. She was less irritable. Her relationships were like, obviously, you're not in pain, you know?
Well, yeah, it's interesting because I think a lot of people, what I call this compare and contrast. If you don't know a different state of being than when you're in, you just think it's normal. And
Correct.
I'll have clients, like, for instance, do the Whole30 diet.
Yeah,
And they'll come back after 35 days or 37 days. You're like, "Oh my god, I didn't realize, like, that the brain fog was not normal, or the GI distress wasn't arthritic or the arthritic type pain wasn't normal because that's just how they've always lived."
sure. And
Yeah.
unfortunately, if you go seek care, the advice is not great, right? It's like, let's it's ignoring the behaviors and prescribing something to mask the symptom. But then all that ever does is down the line something else pops up, and it's just another iteration of their behaviors. You know,
And speaking more of your kind of holistic approach, because I know you take it, and I want to be thankful to you publicly for your help with me. Two other areas that you also work on, and we talked about um, upledger
Mhm.
and craniosacral work. And I don't remember the gentleman's name you also mentioned too. You've been trained underneath his system for the visceral manipulation.
John Pierre Brawl.
Thank you, thank you. Can you talk a little about how you've integrated both those systems into your broader work?
Yeah, so I will say I definitely have less experience with the visceral work than I do with the craniosacral work, but they are very linked. So, um, just for your listeners, craniosacral, the theory or the study behind it is the brain and the spinal cord sit in cerebral spinal fluid. So the best way I can illustrate this is picture a pickle in a pickle jar, right? In the body, we believe that people who do craniosacral therapy believe that that fluid has a current, if you will, and that current can get disturbed from birth traumas to emotional traumas to physical traumas, to certain postures and so on. Via light touch and intention, you can influence the flow of that cerebral spinal fluid and also bones and muscles, but that's getting a little outside into the weeds there. It's an excellent technique that I've integrated for patients who just can't handle certain traditional or conventional manual techniques or fascia work.
Yeah.
Also great for somebody who or someone who's been failing treatment, like they get better and then they regress, or they're not improving at all. It's like, maybe if I calm down myself or my evaluation and just put my hands on their body and ask the body to tell me what's wrong, it may lead me down a different path than what my evaluation brought me to, if that makes sense.
It does.
Uh, and that's helped get me out of pickles when, I'm 2, 3, 4 sessions in and we've made some progress, but not enough based on what they're complaining of. And I have an open discussion with my patient. I'm like, let me try this technique. It's going to feel weird. You're going to feel like I'm not doing anything to you. My eyes will be closed at certain uh, parts so I could focus. But it usually brings to light something that I missed in my evaluation because it wasn't sensitive enough to pick that up. And that's where that like light touch and kind of like quieting the room and listening to what Claudius say. And the visceral work has been great for patients who've had like diarrhea, people who are bloated, people who are constipated, people who have, I was just talking to a young girl who's got pain with her periods. Like,
Mhm.
I actually worked on my wife with this. I worked on her uterus and her ovaries, which really helped her cycle. And again, that it's the same type of approach of, putting your hands over the organs and listening and feeling. And when we say listening, it's not actually listening
Yeah.
to your hands and feel where the organs are pulling you to evaluate whether that's something that's normal or abnormal. And then you would treat it. And then really it's just evaluating the response, and seeing how the body and that person responds to. I've had a patient who was peeing 15 times a day
Wow.
and we did some work through her bladder and her hip flexors and three visits later she was back to normal. And
Nice.
that would never get picked up in conventional PT stuff because you wouldn't even know how to feel that organ or evaluate what's happening, and it's a super light touch. um, so it's been pretty transformative, and it's just very interesting because when I first started doing it I was like, this is bullshit. It's like, I'm not feeling any of this. What am I spending money on? And then, I said, what the hell? Let me try it on a few patients. And I failed. There were definitely patients who didn't have any reaction. But once I started getting reactions that they would say I would, then I was like, oh, okay, I see. I needed to win first to understand how to kind of use it moving forward. And then once that started happening, I'm like, okay, and now I feel what they're talking about.
Right. Right. I love that.
Uh,
I'm going to say this metaphorically, but the way I kind of think about organs is they have a pulse, they have a breath. Like
Yes.
breathe like a lung would breathe.
Yeah.
And because of stressors or fascia tightness, which can be a result of stressors, physical stressors or emotional stressors, like, doesn't pulse or breathe as it should normally.
Right.
And that has a whole bunch of secondary consequences in terms of the function of the organ itself. And I just imagine, like, you're feeling into that and helping it kind of breathe more fully to do what it's intended to do.
Sure.
Is that a good metaphor?
Oh, I think it's great. I think, you know, something I liken it to is like in acupuncture, I mean, which has been around for thousands of years, right? It's like, how do you normalize, quote unquote, a meridian? Well, I mean, if you break that down, organs are going to be along those meridians. So if there's a dysfunction in the meridian, you can almost assume that if there's an organ in the way, then there might be something wrong there. It's not breathing as well. It's not moving as well. It's not functioning as well. 100%. I think that's a great metaphor.
You mentioned at the very beginning, and there's some more Eastern oriented approaches that you've integrated into your work. Can you talk a little bit about those too?
I've dabbled in Reiki, but I guess what I meant was, and I should be clear, when I describe craniosacral work and the Baral work, I kind of liken it to Eastern medicine, where it's like
Um,
it's not as conventional or like your knee doesn't bend, therefore you have pain. It's like I need to feel what your energy, what your body's telling me, um, in a non-movement way. Because as you've experienced with some of the visceral and cranial work, you're just laying there.
yeah.
Like you're not moving. It's letting the body tell me. And I guess I use the Eastern medicine quote because I feel like that makes sense in people's
Yeah.
skin. You know what I mean?
Oh, yeah, that does make sense. How do you keep yourself sensitive? Like, so you're listening with your fingers and your hands, and
So that's a really good question. I'm smiling because I remember a pivotal one of my mentors had told me like when I was training for the manual therapy course, I was very heavy handed. I kind of came up in a strength and conditioning world, so for me, it was a lot of like, get off your ass, like you can move, and I was very good at using exercise to get people out of pain. But then I came across people who didn't get out of pain through exercise. And when I started doing the manual stuff, I was frustrated because I just couldn't control my pressure.
mm,
So my mentor told me, you need to do everything in life as soft as possible. When you close the door, close it very slowly. When you go fill up your water pitcher, fill it up slowly. Turn the faucet on slowly. Turn the faucet off slowly. When you return it back in the fridge, don't make a sound. Close the fridge slowly.
that's
When-
great.
Yeah. When you take your shoes off, place them nicely. Um, and even in day, because not every day is perfect. Like if I'm stressed from something else or angry or whatever, I kind of use that back in my head and kind of step back from the patient and go like, let me put my hands on you gently. But yeah, there was like 2 years of practicing that intentionally.
Mm,
And it's so funny because when you slow down and you use sort of that sensitive approach, you pick up so much more. You know what I mean?
100%. Oh yeah, yeah. What would you say are the big lessons you learned about yourself in this whole process as you've helped other people get out of pain and be more optimized physically?
Two things: empathy, right?
Okay.
I grew up in an environment where it's like, suck it up, get out there, you'll be fine. Like you're not dying, so you're fine, which I still think is a good attitude. But I
Mhm.
think there are some people in order to help them, you need to take your own ego out of it and put
Mhm.
yourself in their shoes because they're not seeing it from your perspective. And I was not as successful with my cases until I started being more empathetic instead of looking at them and with a judgmental tone and more of like okay, I can understand why you feel this way. One of my mentors another one of my mentors really helped me with that. And then the second thing was talk less, listen more.
Okay, so I want to hit on both. With the first one that comes to mind is in Zen they talk about grandmother Zen and grandfather Zen. And grandfather Zen, they hit you with a stick to wake you up. Sometimes you just need to be hit by a stick. In
Right.
Zen, they literally hit you with a stick. I don't mean that literally. In this case, and then grandmother Zen's like you hold them to wake them up. You offer connecting and care and compassion that way. Now, hitting them sick can be the compassionate thing to do. Some people need to be hit by a stick. Some people just need to be held. And what I'm hearing you say is like, from an empathetic point of view, some people just need to be literally or figuratively or symbolically held.
Mhm.
And other people, yeah, no, you need to hit them with a stick to wake them up to do the thing.
Right.
Okay, cool.
And
Um,
that's yeah, I mean, that's and as you know, that's the art, right? Like,
yeah,
medicine is not, I'm learning it's more art than it is math or a science because if you can connect with the person, which is the art, you're gonna win more times than not.
yeah,
You know what I mean? And by winning, I mean helping the patient solve whatever problem they're coming with. And I've never heard that, but I think you would agree, like, in when you see clients, like, how do you balance that? And the person who can balance that and figure out which one they need, or maybe it's a little bit of both or 60/40,
yeah, yeah. And it's yeah, yeah.
you're gonna have good results with them.
Right on, right on. So, what would you say is like what's exciting you and your cutting edge these days in terms of like, man, I really want to learn this thing to integrate in my practice, or maybe I'm seeing this more and more in my practice. I want to do a deeper dive into it. Anything like that for you?
Yeah, so recently I've seen a lot more people get like stem cell injections and PRP and stuff like that. I haven't educated myself on it too much just because of time constraints. And I have a wonderful woman I use in the city. Her name's Dr. Elise Weiss, who I'm just kind of like, all right, go see her. She knows it. Whatever she says, right? Because she's done such a wonderful job with a lot of my patients. But I've seen that really turn around a lot of cases that I thought were done for. Um, there is a guy named Naughty Aguilar who's using a certain way of training based off the book Anatomy Trains. So
Oh
it's
yeah.
basically like fascial slings and training that way. The guy's pretty arrogant, but I think he's just trying to put himself out there, which is smart marketing, if you ask me. But in any case, I really want to learn his system because I do think there's a lot to the old strength and conditioning systems, like your traditional power cleans and squats and deadlifts and bench press and push-ups and body weight training and kettlebells. I do think that's all still great, but it's nice to have another tool in your toolbox in terms of like rotational capacity and being able to connect your foot to your shoulder. And I think he does a really good job about that. And he has a really, really good, like he's posted a lot of cases of changes with patients who have scoliosis, which I think right now our current understanding and treatment methods for scoliosis suck.
Mm.
I really like what he's doing, so I hope to eventually get into some of his courses and learn some of that stuff.
Offline, I'm going to ask you to send me a link to his stuff so I can check him out.
Sure. It's
Yeah,
cool, man. I actually work with a guy in Greenwich who is trained through that system. I think he's got one more course before he's all done. But so far, all my referrals to him love it.
nice. That's
Yeah.
awesome. That's awesome. Love that. Okay, so people are listening to this. Well, actually, before I even go there, I have one more kind of more of a cultural question.
Sure.
So sociocultural question. Now, you're well educated, like, and you look at the whole human system. My understanding of most people in particular fields of study, like medicine, PT, they're pretty siloed. You know, it's rare to find someone who's more comprehensive. Do you see that changing in medicine, particularly broadly speaking, or in your field particularly?
I think in in the physical therapy field, um, it has changed a bit. I do believe a lot of physical therapists understand the interconnectivity of the body. Where we fall in short is people get discouraged in trying to convince people of what we know, right? As far as Western medicine, it depends. I have some docs who are like phenomenal. Like they're all about it. They acknowledge that they don't have the time or expertise to learn all that, but are happy to refer and happy to learn if they can on a quick 15-minute phone call.
Yeah.
And then you have some who are just like, that's complete bullshit. And, to those people, I think the broader problem is they're just not, they don't really care. They're kind of at the end of their career. They want to close up. They want to sell their practice or whatever. They're not too interested in learning more, right? They've stopped being a student is
Yeah.
more of what I've seen. And I don't know if that's a medical problem or if that's just a personal problem, you know?
I think it's a personal problem. And one of the things I never want to do is become Johnny One Note. Like, I hope my thinking's evolved a year from now or 5 years from now or 10 years from now. But so I think it's a human thing.
Yeah.
We
Otherwise,
tend to
life's
be
just it's fucking
with that.
boring. I agree. I mean, otherwise it's fucking boring, right? Like you do
Yeah,
this
yeah,
shit over and over again,
exactly.
Uh,
All right. So my last question for you is like people are listening to this or viewing this and are like, oh man, he sounds great. How do I reach out to him? How do I learn more about what he offers?
Yeah. So you can find me on Instagram. I think the handle's Prime Physio underscore. There's a link there to my website. We have an office number on the website. You can call and give us a buzz. Joe will line you up. And then I believe the link also allows you to self-schedule, but I have access to the Instagram account. You can reach out to me if you have specific questions. I'm not too great at getting back to people inside of 24 hours, but after that, I'm usually pretty good.
Yes. Cool. Well, thanks, Vincent. I appreciate your time, your wisdom, and personally, I really appreciate what you've been able to do for me. So
Uh,
thank you.
yeah, of course. It's been my pleasure. Thanks for having me on, Mike.
All right, buddy.